Hi, my name is Brooke and I will be your nurse today, and I will be assisting you with a bed bath. So first things first, what you want to do is when you come in, you want to look at the patient's file, make sure that there are no restrictions, and in this instance there are no restrictions. And then you want to perform your hand hygiene and put on gloves, and you want to go to your patient and have them identify themselves. So sir, can you please let me look at your wrist and your wristband, and can you tell me your name and date of birth? Perfect. So as you are, you have your materials by the bedside. As you are lifting the bed to your height and lowering the bed rail, you want to make sure that you ask your patient if he or she needs to use the restroom or use the bedpan. And for this instance, he does not. So you're going to grab your bath linen and you want to put it on your patient. And you want to grab his blanket, him or her, and you want to put that blanket on the back of a chair. Next you want to do is help the patient with undressing himself, so taking off his gown or her gown. The reason for the bath linen is to make sure that the patient is covered. Next, you want to put on a bath towel. This is kind of just to assist you with drying off the patient and trying to keep the patient as, like all the blankets and such, as dry as possible. You also want to make sure when you look at the file, like if the patient has an IV or such, you want to make sure that you assist with that and take it out and all that. So next, you want to take your basin and you want to fill it with warm water, about 100 degrees Fahrenheit. And you want to take your washcloth, and there's no cleanser in the basin in this situation right now. So you want to put your washcloth in and get it all wet, rinse it out, and you want to take the washcloth and go from the inner eye out. And then you want to help with the patient washing his face. Help dry. Then you want to rinse the washcloth out and make sure that you get behind his ears. Okay. Next, what you're going to do is you're going to change the water. You want to put another warm water in here, but with this time with cleanser. So when you do this, you take off your gloves, perform hand hygiene, and then put the water in and put gloves back in. So this time the basin has a cleanser in it. So what you want to do is you want to expose the patient's arms. And you're going to take the washcloth and you're going to wash his arms and his auxiliary, his chest, upper chest and under the neck. Make sure you get the other arm and under the other auxiliary. Put the washcloth back in the basin and dry off the arms and the auxiliary. Next, you want to expose the patient's chest and stomach, or abdominal area. And you want to take the water and make sure you get each and every nook. If you have a female patient, you want to make sure that you're getting under the crevices of the breasts. Dry the patient off. Next, you want to expose the patient's legs. You're going to take the washcloth and get the legs. Make sure that you're getting behind the knees and getting the feet and toes. So you're going to yet again take your gloves off, perform hand hygiene, and put new fresh warm water in here and cleanser. And then you're going to assist the patient with turning on their side. Making sure that they're comfortable at all times. So you want, in this instance, you want to expose the patient's back and buttocks, and for him, his tail. So you want to make sure you're getting your his back, his buttocks, and his tail. Dry the patient off. So yet again, you want to assist the patient with turning back onto their back. And you will ask the patient if they want help cleaning their genitals. In this instance, he would like some assistance. So you're going to expose. You're going to take your washcloth and clean. Then you're going to dry. So now that he is all clean, you are going to assist the patient with getting clothes on. You want to make sure that you ask the patient if he wants deodorant, he or she wants deodorant. So in this case, he does. Ask if they want makeup, if they're female or whatever. He does not want makeup, so his clothes are on. So you're going to take your bath towel and put it aside. Well, you're going to take your bath towel, my bad, and put it on the pillow, because you are going to assist him with brushing his hair, and you don't want the pillow to get wet. So brush his beautiful hair, and then put the towel aside. You can take the bath linen off, since he is fully clothed, and then put his blanket back on. Assist the patient into a comfortable position. Make sure that they have all that they need and make sure that they're comfortable, and lower the bed and put up the rails and tell them that you hope that they have a wonderful day. So I hope you have a wonderful day, sir, and that is all.